Hey y'all, this is Garrett Greer, a member of the Supported Employment Team with the Alabama Department of Mental Health. Today, we're going to talk a little bit about what is a pandemic and what to do during that pandemic. We have with us George Neal, the Director of Self-Advocacy Services, to help guide us through this process. George?
Thank you, Derek. Now we will talk about what to do during a pandemic. What is a pandemic? Well, we're going through that now. COVID-19 is a prevalent not only over our country, but over the whole world. When you don't feel good, what do? Well, if you have a fever, call your doctor. If severe, go to the emergency room. Bad cough, body aches, chills, and shakes. You see a doctor for any of these above symptoms. Okay, let's look at some tips to protect yourself. Avoid close contact with people who are sick. Stay 6 feet away. Clean your hands often with soap and water. Sanitizer that contains at least 80% alcohol. Stay at home as much as possible. And clean and disinfect frequently. Touch surfaces and objects daily. So, what does this mean? In order to avoid the coronavirus, wash your hands often, stay home as much as possible, wear a mask and gloves when you go out in public, and be responsible. When you're finished, throw them in a trash can. Coronavirus. What are the symptoms? Fever, dry cough, fatigue, muscle pain, headache, and sore throat. What should you do if you get sick? Find a testing location, call your doctor, follow the doctor's orders. The doctor may admit you to the hospital. It will depend on the course of treatment that you need, and stay away from other people for at least 14 days after your symptoms are gone. Quarantine yourself. The ARC of the United States has some resources. CDC materials on COVID-19 and Down syndrome. The education section questions and answers on providing services to children with disabilities during the COVID-19 outbreak. For more information, visit thearc.org/COVID. During this time, why should people with disabilities be extra careful? People with disabilities might be at increased risk of becoming infected or having an unrecognized illness. You should discuss your risk of illness with your healthcare provider. People who have limited mobility or cannot avoid coming in contact with others who may be infected, such as direct support provider or family members. People who have such trouble understanding information or practicing preventive measures, such as washing hands and social distancing. People who may not be able to communicate symptoms of illness, and we should keep an extra eye on these people. Please be careful. Remember to keep your hands washed, and remember to keep all surfaces and objects wiped down. Why is it good practice to have regular visits to the doctor? You can keep track of your weight, blood pressure, and blood sugar if you have diabetes like I do. With regular visits, you can catch potential problems early. You are able to talk regularly to the doctor about health issues and concerns, and that would be good to ask questions, especially if you don't understand. Why should we always try to stay healthy? You can do the things you want and like to do. You're able to work and make your own money, to go out to dinner with friends, go to the movies with friends, and go shopping. When you are healthy, you feel good, have energy to do things. Always remember to eat healthy, exercise, get plenty of rest, and drink plenty of water. Thank you, good luck, and stay healthy. If you have any questions, please contact me. My information is down below.
Thank you, George, for helping us better understand what to do during a pandemic. While our world is changing at a record pace, these new uncharted waters we have to navigate together. We have to utilize the technology that we have, such as the internet, Zoom, YouTube, and keeping up with our news sources so that we can stay as educated as possible in this ever-changing environment. Remember, as we move forward, to wash your hands, sanitize and disinfect surfaces and household objects to kill germs, maintain social distancing, and wear masks and gloves to help protect others around us. We're all in this together. And as we move forward together. So remember, we here at the Supported Employment Team of the Department of Mental Health are here to help in any way that we can. If you have further questions concerning this short training, please feel free to reach out to George at george.neal@mh.alabama.gov. This is Derek Greer with the Alabama Department of Mental Health. Stay safe.